Which of the following statement relating to the biliary atresia is untrue? That means which is not true regarding the biliary atresia. So which is not true regarding the biliary atresia? Here are the options. Options are: it is most commonly present prolonged conjugated jaundice in the neonatal period. Evidence of portal hypertension at diagnosis is seldom present in the UK. It may be confused with allergy syndrome. The Kasai procedure is based in the first 8 weeks of the life. Survival following successful Kasai procedure approximately 45%. So which is not true regarding the biliary atresia? Now say it is the normal biliary drainage. Actually what happened, the bilirubin, unconjugated bilirubin from the blood, the unconjugated bilirubin, it from the blood vessel, unconjugated bilirubin enters in the liver, and the liver conjugated this unconjugated bilirubin into the conjugated bilirubin by the help of glucuronide transferase enzyme, and after that the conjugated bilirubin, it goes to the right and left hepatic duct, then common hepatic duct, then common bile duct, and finally it reaches to the duodenum and small intestine. So it is the normal pathway. But in case of the biliary atresia, what is the biliary atresia? The biliary atresia means there is the atresia or congenital obstruction of the common bile duct. We know this portion is the common bile duct. Here we can see this is the common bile duct. So there is the atresia of the common bile duct here. So what happened, the conjugated bilirubin, it cannot go from the liver to the small intestine, and for this condition this conjugated bilirubin backflow, and finally it reaches in the blood vessel and increases blood level of the conjugated bilirubin. So it is in very short about the biliary atresia. Now in this picture, let's see the biliary atresia. Here we can see this common bile duct from here up to here. From here it is the common bile duct up to here, and here we can see there is the obstruction in the different place. In the first option, here we can see there is, in this place there is the obstruction. In this second, here we can see this is the portion, and third, here we can see the obstructive area, and fourth, it is the most dangerous condition here, type 3, and here we can see it starts from the liver and up to the small intestine. So what can we do in that situation? So let's say the biliary atresia present with obstructive jaundice, and the jaundice usually conjugated jaundice or conjugated bilirubin. Why conjugated bilirubin? Because there is the glucuronidation completed. That means the unconjugated bilirubin converted into conjugated bilirubin by glucuronide transferase enzyme, it is completed in the liver. So it is now conjugated bilirubin. So blood level of conjugated bilirubin is increased, and in the lab findings, if we investigate, the conjugated bilirubin increase. Kasai procedure performed in the first 8 weeks of the life. So what is Kasai procedure? The Kasai procedure is a procedure in which the small bowel is connected directly to the liver, and the Kasai procedure is successful. Most of the patient will not require liver transplant. So Kasai procedure, it is a special type of procedure, and it replaces the liver transplantation. 45% patient post Kasai procedure will require transplantation. So transplantation requires only 45% patient among the 100 patients. However, overall survival following successful Kasai procedure is 80%. So survival rate is very high. It is the 80%. So it is very, very high, 80%. And here we can see the Kasai procedure. So what is the Kasai procedure? First of all, it is the normal. In normal, what happened here, we can see this is the right hepatic duct, left hepatic duct, and then it from this one is the common hepatic duct, and then this part is the common bile duct. And what happened, there is the atresia in this bile pathway. So what we can do, Here this is the procedure, and here we can see the small bowel is cut and it is directly connected to the duct where the left and right hepatic tract present. So what happened then, the conjugated bilirubin, it comes directly to the small intestine, and it is the Kasai procedure, So what happened, the atretic part, that means when the disease part, here up to here there is the disease part, so the disease part is removed, then the bowel, here the small bowel, it connected with this part of the liver. And in the second picture here we can see actually this is the procedure, that means the small bowel, it is connected to the hepatic duct. Here we can see the LG syndrome. It is autosomal dominant disorder. It is characterized by presence of paucity of bile duct and the cardiac defect. And the biliary atresia, usually this portion is absent. The embryonic form of biliary atresia is associated with cardiac and other embryological defects sometimes. So which is not true or which is false regarding the biliary atresia? Here we can see the survival following this successful Kasai procedure, it is 45%. It is not true, because after Kasai procedure the survival rate is 80%. It is very, very high, 80%, not 45%. Other options here, such as it is commonly present in prolonged conjugated jaundice. We know it is true, because when it goes to liver, the unconjugated bilirubin converted into conjugated bilirubin, so blood level of conjugated bilirubin is very, very high. Evidence of portal hypertension at diagnosis is seldom present in the UK. It is also true, because as in earlier stages, that means this disease is present very short period of time, so there is usually no portal hypertension. It may be confused of Alagille syndrome. It also true, because in case of the Alagille syndrome there is cardiac abnormality, and in case of the biliary atresia there is also the cardiac abnormality. Here we can see, and it is characterized by the bile duct pathology. So as it is bile duct pathology and also the cardiac abnormality present, so it may be confused with this syndrome. Kasai procedure is best performed within the first 8 weeks of the life. It is also true.